If I was your doctor and you came into the hospital for some reason and you were having some problem, and say your spouse or one of your adult children was here because you were now in the hospital, and you're laying there in the bed, and I turn to your spouse or your child and start explaining them what the problem is and then asking them what we ought to do, how many of you would be happy about that? You would like that? That I asked your spouse or your child instead of you? And maybe I wasn't distinct enough. I'm talking about instead of you, basically ignoring you and ignoring your opinion and asking your spouse or your child what we ought to do. Well, fundamentally, that is at the heart of what advanced directives are all about. It is a way for you to continue to be present in your medical decision-making when you are no longer present. So while you're here and able to speak to me and answer questions, my directive as a physician should always be to talk to you, to find out what you think we ought to be doing in these circumstances. Advanced directives have to do with what happens when you are no longer able to answer those questions. So either because of a serious immediate illness that's fixable, or maybe you've had a bad stroke, you can't understand what I'm saying, or your consciousness is impaired. Now I need to know who to talk to, and also what to believe about what your wishes are. And that is the role of an advanced directive.